Welcome to A Shot in the Arm podcast. I'm your host, Ben Plumley, and this is a podcast about innovation and equity in global health. Now, before we get into today's episode, just your friendly reminder to subscribe and give us 5 stars wherever you download your audio podcasts. We couldn't do this without you, so we're hugely grateful for all your support. And if you haven't already, please do visit our YouTube channel at www.youtube.com/shotarmpodcast. Subscribe and hit that notification button so we can let you know when new episodes go up. So, about today's episode, we are going to meet the Chinese-born biopharmaceutical industry leader, Thomas Cai. He is the CEO of Open Source Technologies based in Cambodia, but he's also a community organizer, a community advocate, and perhaps most importantly, one of the most influential thinkers in social entrepreneurship today. We have quite a wide-ranging and quite a conversation is all I can say, and I hope you enjoy it. Thomas Cai, welcome to A Shot in the Arm podcast.
Thank you. My honor.
No, the honor is actually all ours. We've been trying to get you on the show for, well, really since we first started 5 years ago. So it's great that we could do this. And viewers, if not listeners, will notice that we're not in our usual studio. Thomas and I are actually sitting together. We are in a rather nice hotel in Phnom Penh in Cambodia. Why am I here, Thomas? Why am I here with you in person?
And actually, we are doing some work here. We need some advice and some strategic development. That's why I feel that you might be willing to help on NGOs when your schedule could allow you to do so.
Now, you see, whenever Thomas says we might ask you to help, what it actually means is you have already been roped in to do this for us, and you're doing it whether you know it or not. So, of course, Thomas, whenever you say jump, I say how high. Now, we've known each other for many, many years.
Like 12, 15 years.
Yes, but in fact, somewhat like my other co-host, Yvette Raphael, I met you in 2003, 2004.
Yes.
Through the UNAIDS office in China.
Yes.
And through our good friend, who was then the UNAIDS country coordinator, Bernhard Schwartlander.
Yes.
Yes. So you've had an extraordinary career before and since then. But I introduced you as the Chief Executive Officer of Open Source Technologies, which is based here in Phnom Penh, Cambodia, but which is if not a global, certainly a regional organization. Can you tell us a bit about what it is that you are seeking to do and what you are doing with open source?
Open source is a social enterprise. It registers as companies. And our main business is pharmaceutical business. We are actually distributing medications to the market. But different to many people were very surprised. A pharmaceutical company should have dozens or even hundreds of items. And but our company has only a handful of items because we are very focused on 2 diseases only, hepatitis and HIV.
And it's interesting because, and we'll get onto your career in a little bit, you started in the HIV arena, but actually it's hepatitis that has become so important to you. And I think that's a great way for us to describe the importance of hepatitis in Southeast Asia and indeed East Asia generally.
Yeah.
How much of a problem is it? And why do you see the need for a very specialized infectious disease pharmaceutical company to prioritize hepatitis?
Okay. In Southeast Asia, I'm not a medical doctor. I'm not a public health specialist, But I noticed one thing in the reality is, in Southeast Asia, a young couple, they have nothing, they fall in love, they get married, they work very hard, they start to buy a motorbike, maybe, and then start to build a small house, and then they have children. And then when they're getting into their late 30s or 40, one of the family gets sick. And also it's like a complicated liver problem. So by that time, to save the life, the family have to use all their savings and even sell their house and then sell their motorbike, even in debt. And the kids might drop out of the education. So the family, after so many years, back to scratch again. And a lot of these cases actually are caused by the hepatitis B or C. And so because of this, I heard a lot of stories. I keep hearing about similar stories. So then I started look into the issue. When look at the WHO data, I don't feel it's a right number because it's only like a 1%.
So you think that the WHO data, and of course that comes from the countries themselves, it's the sort of coordination of it, the collation of it, but you feel that that data significantly underrepresents the problem of hepatitis B and C in the region?
At the beginning, I doubted it. And because, it's not a big issue. And but later, I read an article, a report of MSF in Cambodia. And they did it in an area of Cambodia, in one province. And they found out many patients. They do the test, the positive rate is very high. So then I start to have a question, what happened? And then after I talked to different people, they told me that the WHO data was not updated because it was based on the blood bank, the blood donors test results. So in reality, it's much higher. So how high it is, then we start to moving into the hepatitis work. And we actually found out that it's shocking. And we can't say our data is reliable, but we can say almost 1 out of 5 have a risk with either hepatitis B or C.
So Thomas, with hepatitis B, you're obviously seeing that it's much of a greater problem in the region than perhaps was first thought. Why is that? Why is South and Southeast and East Asia so badly hit by the viral hepatitis?
I'm not in a position to give an accurate answer on that, but I know that the vaccination program starting late is one of the reasons. And some of the country, the HPV vaccine just starting like 10, 20 years ago, and it's not fully covered. But for the generation before that, so it happens very high positive rate among the people 30 years old above.
So it's become endemic in the population, and it's because of the delay of the onset of the vaccination strategy that has really...
And also it's about the awareness and the people how to prevent the transmission, right? Like the clean needles, right? Safe practices, right? And it was not well aware in the public. So, and also hepatitis B is very similar to HIV, HCV. They are silent killers. There's no symptom, and for a long period of time, and then people just like don't really see the risk of this silent killer.
we're going to come back to regularly to the frustration, and I hope you don't mind my saying this, the anger that you sometimes have about the state of health globally and across the region. But one of the things that must be quite frustrating to you is that, notwithstanding the viral hepatitis as being silent killers, they have exceptional treatment options. We can pretty much cure hepatitis B, right?
Hepatitis C.
C.
Yes.
And we can certainly get hepatitis B under control.
Under control, yes.
So, and we've been able to do that through antiretrovirals, sort of the same class of treatments that we've had for HIV medications. So why has it not happened that the region here in Southeast Asia, which is frankly so organized compared to Europe and other parts of the world, why has it not mobilized and got everybody on treatment? What has held it back?
I think the financial issue and the operational structure, and I think in this region, like the tax money for the government is not enough to cover all the bills, and this country quite partially or heavily depend on foreign aid, and also the healthcare system is there, but it's not very strong enough to cover everything, and a lot of private sector fill the gap of the medical services, and then the cost become a burden for the public, and also the public awareness as well. I think multiple reasons to cause the tragedy happen.
For listeners and viewers who perhaps aren't familiar enough with the pricing issues for hepatitis medications, is it basically the same thing as we saw with HIV, in that the medications were developed for the industrialized world, but the prices didn't come down for other parts of the world?
Yes, and in some way it's similar, but with the pushing for the generic medication, patent pool, all this, the price has gone down a lot. Cannot compare with the developed countries, and it's much lower, but still quite expensive for the local people. Just for example, hepatitis B, the hepatitis B treatment in these countries could cost the patient $25, $30, or even more US dollars per month.
Per month?
Yes, while their monthly income just 100 plus, or around 200, majority of people. So it takes about 15 to 20% of the income just for one disease. So I think this is quite a heavy burden, and also the viral test. And I heard many cases. The people, they starting the Hep treatment for a couple of months, they lost their job, they stopped the treatment. And after years later, they're coming back again. They already developed to quite complicated stages. So all these tragedies happen every day. So I think it's so important to have some methodology to do it. And different to HIV, hepatitis doesn't have a Western supported most of by the global efforts on the global fund for TB, HIV, and malaria. But hepatitis is not in like that. So rely on the local government's financial capacity is very hard to reach.
So Thomas, you've given me a wonderful opening here, because the big question would be, okay, should there not be a global fund for viral hepatitis? Or should the global fund to fight AIDS, TB, and malaria expand into viral hepatitis? And this gets us into your philosophy of how long-term sustainable responses to infectious disease should really be country-led. And you've deeply, deeply affected me and influenced me. And I know my co-host in the Global Health Diplomats, Eric Gooseby, as well, in thinking here. So would you like to see a global fund for hepatitis?
No. Frankly, it will be a disaster. And I think Global Fund, at the very beginning, they were very ambitious. And I remember in 2002 or 3, in Cape Town, the first ITPC meeting, I was there.
International Treatment Preparedness Coalition.
Yes. And we were so passionate. And then I remember one day, one of the activists putting a bag on the table, say, let's donate to the Global Fund. Let's support Global Fund to make access to treatment for everybody. It was a big thing. And because people dying, and tens of millions of people are living with HIV without treatment, and then they're dying. So it was a big deal. And then in the following 2-3 years, even China, the free ARV started. Okay, so that saved the world. But we were so grateful about this. But later on, we found out that Global Fund has been a little bit low performance, and also cultivating a lot of bad norms. And I don't think this is a good system anymore. They're having a mandate to spend all the money, but they don't have really good strategy and time to thinking how the value will generate with these investments. And sometimes I make a joke. Global Fund is the process, spend the money printing the invoice to cover, to make a financially transparent and clear. So about the impact, it is really bad. And also it's very, very expensive programs. And it's like they call country lead, and they don't really consider the capacity. I mean, not finance capacity, the management capacity, the operational capacity of the local, and then just believe that we put the money in, it works. And but in reality, it's not.
Now, this, of course, is quite an earth-shattering criticism of the Global Fund, but I sense that it's not just the Global Fund that you are criticizing. In many ways, the Global Fund is as much a victim of this as the countries that are beneficiaries. It's sort of more the model, the way we think about global solidarity in health. And you'll note that I didn't say how we think about global aid. It's your sense, is it, that it's the whole structure, the whole philosophy that is wrong? It's not about largesse coming from the north to the south.
And then also we need to make sure that one country, they cannot putting their people's health on their foreign aids, their responsibility. No country should take care for the other countries' people's health. And the foreign aid, and I think without good strategy, it generates dependence. I remember in 2010, around that time, the treatment 2.0 was just coming out. I was joining a UN high-level meeting in New York. We were talking about test and treat, optimized treatment. And I remember an African delegate sitting just right in front of me. He come out and say, Yes, um, treatment 2.0, test and treat, no problem. But besides the medicine, do you provide food for them? They take the medicine, they don't die, but they need to survive. I was shocking with this question. He's a government officer from one country saying, if there are people, you want to save their life, you feed them. And talking to the international community like this. So I think it's really a shame. But in reality, when I first came to Southeast Asia, I had a chat with some of the health officials. I say, the government has a plan for the hepatitis problem. They said, we're waiting for another global fund. I think it's already become addiction, and then it's very unhealthy. So that's why I say it's not going to last. And the main thing is it doesn't solve the problem. It might treat the symptom only.
Now, you mentioned Treatment 2.0, which was an HIV initiative that both you and I were heavily involved in.
Yeah.
And this idea that after, I suppose, almost a decade of trying to get as many people on treatment as possible, we would then start looking at sustainability. We would then start looking at what are the best regimens, what are the best treatment cocktails, what are the best diagnostics, and then how do we get as many people on treatment as possible in order for them to start living their lives with all the broader questions of social and economic support that you rightly point out your African leader referred to quite rightly. But that was 2010, 2011. And here we are in 2025.
Yeah.
How far have we got? How far have we moved from that dependency, that addiction to aid?
I don't know the other part of the world, but in Southeast Asia, it's quite heavy. And then they have some part of co-financing. Like Cambodia, the government really contribute. Like, as I heard last time, a couple of years ago, like a $4 million a year for the procurement of the ARVs. That was good. And, but many programs, I just worry about. After the Global Fund, the structure it built up for response to the disease, could the government afford to run it? The per diem they're paying, the salary they're paying, it's very higher than the local standard. And also the sustainability is a gap. And for the other part of the country, some countries, I think the dependency is still very heavy. So less money, just do less job. So they're totally like they don't really have the ownership of it. And it's the donor's concern. It's donor's problem. It's not my problem.
It's interesting that you come at it from that perspective of the responsibility of the country rather than the responsibility, say, of the donor, because here we are in mid-June 2025, and we are all reeling from the dramatic cuts to donor aid from the United States. And much of what you say resonates with what we hear from in the HIV field, from the HIV Leadership Forum, which is, about we have to make affordable programs.
Yeah.
We have to not rely on expensive outside NGO or surveillance or electronic monitoring of performance. We have to do it ourselves. So it's very interesting to hear you come at it from this perspective. In the work that you've done in Southeast Asia, do you sense there is a willingness from the governments, from the ministries of health, to step up? And what are they looking for in terms of partners to achieve that?
I think actually, if we do look into the Global Fund program, and I have a business background, so when I look at the things, it's like look at the value and the real cost efficiency of it, right? And I think the local government, they want to find a way out. They, of course, they always try to keeping the response to the disease, right, or up on running. But with the less funding, the government might co-financing. But now the concern is the system exists. Is it a really efficient system? And I give you just one example. In one of the country, the local Global Fund program coordinator told me that in our country, the budget for every patient's treatment is about $500 to $600 per year. And the medicine costs less than $100. So where do the
What is that 500?
500 gone? And mean technical support. And this is a big question. Okay, the overhead is so high. What make that happen? It's like some part of the our overhead cost is totally too high, especially for these countries. They're not United States. The United States is rich enough to cover that, but these countries, if talk about like 10 times to 90% on overheads, so that's too much.
I realize from the start of this conversation, we didn't talk about you and where you're from and your story. And here you are, the CEO of a pharmaceutical delivery company in Cambodia, but you're not Cambodian. Can you tell us a bit about your background, your upbringing, and how you ended up running this regional social enterprise?
Okay. Start from when?
Wherever you like.
Okay. And actually, my background was business. I've been running business in Southeast Asia for a couple of years. And then by coincidence, I started to get involved with NGO work by early 2000. So I established my organization. We're working with medical doctors and the community people to do something for the HIV care and support.
And where was that? What country was that? Because this is crucial.
Okay, I'm from China, and yes, actually, when I talk about I'm running business was in Southeast Asia, but when I started my NGO was in China, and in Guangzhou, my hometown where I grew up. And by that time, I don't know anything about NGO. I don't know what I'm doing. I just say do something good. So I started the work with my own money, with some volunteers, with some very nice doctors support, help me to understand the issue, and we start to providing some support and care to the patient in the hospital, who by that time, because treatment is not yet available in China, most of the people are in the AIDS stage. They so disappointed, and then ARV was so expensive. I remember it was like more than $1,000 per month. By that time, the Chinese citizens' average income is only like $300 per month. So the cost of treatment is more than $1K. So we did some. I don't like to say use the word palliative care, but we were trying to using some psychology tactics to try to making the people feel better
In the final stages of their life, because
yes,
they were really sick heavily infected with long-term HIV
and all different kind of opportunity infections. And also in some cases, we're trying to convince the people when they have the capacity to access treatment immediately. Because what they said, mostly in Chinese, they like save money. In most of the case, they have some savings. They can support their treatment for a while, like 1 year, 2 years, or even 3 to 4 years. But they worry about what happened afterwards. And then I will die. Then why not I just not taking the medication and keep the money for my family? So by that time, from my knowledge that the generic medication just starting, and something is not far away. So I try to working with the doctors together to convince the patient. Use the time to change the space. So pay for your treatment now. The price will come down very soon. And also by that time, I was the one sending email to CIPLA to asking for help. And I know medicine is quite restricted items for especially the prescription required medicine. But by that time, with the support from the local doctors, I was able to manage some shipments of parcels and from CIPLA.
So this is one of the areas where, one of the times when I first came to know about you, because like many of us, trying to get supplies of medication, very small amounts of medication, because we couldn't do it at public health scale, but could we buy medication, perhaps arrange for, I would say, fully legal, although perhaps at the time some people might not consider it fully legal, but to make sure that we could get medications into countries and we could get them to community organizations that we knew who needed them. And I had heard about you doing the most incredible things about delivering medications into Russia, into parts of the Middle East, into one of the things that you did with your organization in China was to provide treatment for HIV positive Africans who were in China, which was a huge problem as well.
Yeah, that was during the, yes, it was a problem. And in China, medicine access, I think it's a basic right for the people. And then I knew nothing about the medicine. And eventually, when I found out the fact behind, I say, why? I know how disappointed people are. They are dying, and the medicine might be just like a few kilometers away from them, and they can't get it, so cannot save their life. And so, again, I still remember CIPLA in the export department. One client called Thomas, yes, and then small orders for the patient in the hospital, and help them a lot. Of course, it doesn't last long, only about 2-3 years, and China has the free ARV program, so we won. So and later on is about a Hep C. What you're talking about Russian is Hep C program. I think when Gilead invented great medication, they did a wonderful job for the society, but they charge $1,000 pill. A pill. It was like most of the people could not afford it. Even in US, without insurance, not much people could afford it. And so that was the case. We start another venture. We're comparing the medicine, the APIs into the capsule by ourselves. We supply to the people for free.
Now, API is an important thing. And for listeners and viewers who perhaps aren't so familiar with it, that's the basic medical product, the medicine before it gets formulated and put into pills.
The pills.
And China, of course, is a great manufacturer of the pharmaceutical product that is then distributed around the world. And again, it's very controversial at the moment. But there was something a bit, how shall I put this? World War II French resistance about you and your team carrying medications in cases and allegedly, and I'm not saying this is true because I have no idea, but allegedly in the linings of coats as well. But the point being, getting the medications to people who needed them, and in ways that, they could essentially put the pills together themselves.
Yes. And it's not our invention. We watched this from BBC because some activists from the Western world, they are very knowledgeable people. And actually a team in Australia, they bought the API from the Chinese company who would be the supplier for Gilead. They bought the API and analyzed in their laboratory. They say, you can just take it directly. And then the UK, there's another team in UK did that. They compound the capsules. And then I still remember there was an interview. The BBC journalist meeting somebody, they say, today I'm waiting my result from my doctor after 3 months of treatment from the Australian compound capsules. And it was negative.
But it's also funny that, you might listen to you and you would think, right, this guy is really clearly anti-industry. Industry hasn't stepped up. It's the same thing that we've seen in the United States. It's the same thing that we see with American activists for a while, leading the charge in Africa to improve access to treatment.
Yeah.
But you've always seen the pharmaceutical industry as a partner, not as the enemy.
Not the enemy. And I think they did great jobs. They invent the medicine, making everything become possible. Then let's talk, right? But when the price could not access, so the formula that people can still using to save their life. And it seems like it's a tragedy, but it's kind of like people find their own way out. And so I think many people did that, not just us.
The buyers clubs in the United States at the start of the HIV epidemic. Yes, absolutely.
Yes. And I think for all these experiences, we know that, but nowadays much better. So thanks for the efforts, the global, including the pharmaceutical company, generic companies, UN agencies, and some Cai, right? And they did make a lot of efforts and finally making the price down.
See, you're sounding very, very diplomatic and political now. Kumbaya, everybody is in the tent. But you've been very effective, and I've seen you do this, pushing partners to agree with you without them necessarily knowing that they fully agreed with you. And it's been it's been masterful, if you don't mind my saying. And we've mentioned a couple of pharmaceutical companies that have partnered with you as a result of that. But the other place I want to look at it, the other lens is, and you touched on this at the start, is about the role of the NGOs, because you've also been really quite scathing about not leaving the approach to scaling up infectious disease treatment. Well, it can be broader than infectious disease, but it starts there. Do not leave that to the public sector. Do not leave that to the NGO sector alone. And that has sometimes put you at odds slightly with perhaps the more mainstream Western NGO activists. Can you explain your thinking on why non-profits and the NGO sector shouldn't be at the forefront, right at the apex, if you like, of the access agenda?
And I think the current NGO model, I think, because I don't think the current NGO model works. And government should have their unique strategy and their style and capacity. But look at the NGO and governments. What are the differences? Because they implementing the principle, everything, no flexibility. They're as bureaucratic as the government system, and even worse. And poor performance that costs too. So I don't think the current NGO system works. And they were there because some in the political part we need them. It's a puzzle of the map. But does it really function? I don't know. I more believe in the business. And I think the business is more flexible if we can running a social enterprise.
But isn't there a risk that what you criticize in the non-profit, in the NGO world, is magnified in the private sector world? I mean, we see this from Western companies, not just in healthcare. We also see it in some, Eastern and Southeast Asian companies. If you're inevitably, inexorably drawn to being a monopoly because that's where you can make maximum returns on investment. How do you prevent the sort of monopolization of any sector into providing care to the weakest?
Okay, at the moment we are very small, and talking about monopolize, I don't think that would be. I always describing the disease control or prevention and treatment is like a transport system in the city, right? You can have bus, you can have subway, you can have taxi, you can have Uber, and then you have limousine, right? So multi way to supply. But instead of that, now it's very boring. Look at Global Fund, TB, HIV, malaria, did not allow private sector to touch. Only the Global Fund can do it. It's really funny. It's monopolized. And also this kind of monopolized doesn't bring in any good. And the people, remember my clinic was shut down in Guangxi, Nanning.
And this was an HIV clinic, a community one-stop shop clinic.
Yes. Because we're getting 30% of the people say we are better than the government who experience our service. So the government, they want to dominate that because there's no comparison. There's no blame. So when the people see our clinic, because we take over the MSF team, we did wonderful job. We charge very reasonable, even better than the government free program. So they use their administration power to shut us down. So that is the thing, that domination is not happen in the business world because more competitions. People can choose. But now in the current system, people have no rights to choose. Whatever they were offered, they have to take it. Just like a city, only bus, no bike, no motorbike, no taxi, no subway, only bus.
It's funny because you're, in a sense, describing something that Mike Reed from UCSF and I were talking about, the National Health Service in the UK that we grew up in, which was, if you like, a bus service of healthcare, and it deliberately wanted to exclude the Uber or whatever the equivalent was, and certainly the helicopter of private sector services. But that's really out of date now. With the innovations that are happening so rapidly in biopharmaceutical medicine, how do you speed up the point of approval, which is usually, let's face it, FDA, American FDA, or the European Medicines Agency? How do you speed that up from that approval to getting it to the people that you serve in Cambodia, Laos, Vietnam, and indeed China and Myanmar?
Okay, I think this is a business issue. You know that I remember that Melinda Gates, she told a story. She was doing something on the TED Talk. It's very probably impressive to me. She said, in every corner of the world, doesn't matter how poor it is, how remote it is, she saw the people having Coca-Cola. So that's the business intelligence, can making the things much faster. So now, I think many generic companies, they try to building their profile and they're getting their product up to the standard. And the only thing is now, we're trying to unite the market to negotiate with the pharmaceutical industry, to getting the people the best deal. And just like a Chai, I have mentioned the
Clinton Health Access Initiative.
Yes.
Yeah. Really important player.
Very important player. They doing negotiation. They have a Chai price list. That's very attractive, but only eligible for the government procurements, blah, 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 this and that. But governments, do they have the funding to do that? Where the funding comes from? Okay, and then the community, the wake-up community, the people with good awareness, they demand for treatment, right? They don't mind paying from their pocket with affordable price. So this time, we united using the market power to try to negotiate with the pharmaceutical suppliers, companies, to getting the deal on that. Not only push the burden to the government.
And you've had in your sights the third party suppliers and procurers of medications who are also as much of a problem here as an NGO delivery mechanism out of hand or a Western pharmaceutical mechanism out of hand.
Yes, because now they're using some very fancy channels, like for example, they're using the local limited budget to go for UNDP procurement process. It's 15% gone just for the handling. You have such a limited budget. Why don't you go to buy yourself? Why are you using UNDP, right? It's like a taxi by Rolls Royce, right? So I think we believe that with the business operation, we can try to mobilize the market. That's what we call awareness, and we will get the community participation. That's what we always talk about this, but it's not meaningful. This time we make the community pay from their pocket, real participate. They want treatment, right? And then we're making very affordable medication to them.
And they've got a stake in it if they are paying for it.
Yes.
And it may only be $1 or $2, but if, going back to what you said earlier, if your monthly income is $100 or $150, that's a much larger proportion of your income than, say, $50 if you're living in the United States and you have a six-figure salary.
Yeah.
It strikes me that when you talk about this being a business mindset, what comes across to me is a sense of a disruption mindset, as if you're asking, why is it being done in this way? Whether it is the provision of medications for hepatitis, the diagnostics for cancer, or any of the therapy areas that open source technologies is involved in, or even if it's the provision of solar power. But you're asking, how do we disrupt to make things better? And it's interesting, if I'm right, and you are doing that, because it's very different from what we're seeing in Silicon Valley, which is we'll disrupt things and then let's see how they pick up and let's see what comes out of the chaos and debris that we've created. Am I right in thinking that you're big interest is in disruption for innovation's sake. You want to do things differently and better.
Yeah. I think the system always need to update it and need to be optimized. We learn the problem, we solve it. So, right? Like our phone, keep updating the system, make it better and better. And our operational system, it doesn't work. And we burn a lot of money. And the problem is still there. And I think why not we change it? It's not that expensive, not that costly if we do it right.
It's sort of in your DNA to be asking how to do things differently, how to make things better.
Yeah. Because I grew up, our age, 80s in China is the decade of change. And then everybody thinking about where should we go. And we always concerned about our country's policy. It should go socialism or capitalism. And everything is facing change every day. So we try to adapt to the change, but actually our life, the only thing not going to change is change. And I've changed a lot myself. Before the year 2000, my philosophy is, if I have money, I can do anything I want. My happiness is money. And then after the year 2000, things start to change. During my work, I was very honored to work with some of the celebrities in the business sector. Mr. Bill Gates.
Oh, yeah. I mean, you met him numerous occasions.
Yes.
Yeah.
Yes. I met him in person and I had lunch with him and I had dinner with him. He's a great person, very inspiring person. Inspiring not because about he's a billionaire, right? But the inspiring is about his philosophy of his foundation. I know some people criticize it, but to me, my understanding, I don't know things behind that. I see the people has such a good social responsibility, taking care about the disease not relating to him, taking care about people in a different corner of the earth, they might not even see each other the whole life. And I think it was very inspiring. And he guiding me to think about the meaning of life, right? And then when you're getting very rich, means what? And the money just a number. And then it's something should become a responsibility for the world and return to the society. So what he did actually made me change. And finally, I'm thinking about, yes, when you get rich, you should make the world a better place. So what about when you're not rich? You can't do that? So people telling me that actually from working with Bill Gates and people like him, and also the other guy, George Soros.
Yeah.
He gave a lot of money to us to do amazing works. Not because of the money. My salary is, as I told you yesterday, my salary no more than $1,500 per month. But I was so honored to using their money to deliver changes, even a small part of the world, on a specific cases. I found out I'm so enjoy and happy when working on that. So when people say billionaire doing charity, but when you are millionaire, you can do the millionaire way. If you have $1,000, you can do it on $1,000 way. Don't make an excuse from that. And I believe our life, there's a mission. At least I think our mission is experience this world and learning from it and growing and change it, make it a better place.
So, Thomas, I feel we're getting on to almost a spirituality conversation. What you're doing in your life, what your role is, what your mission is to be here. Are you religious? Do you have faith?
No. I grew up in China. At that time, in China, we don't have any religion. And since I was grow up, I think I missed the age of getting into religion. And also I get in touch with Catholic, Christian, and Buddhism, and some Muslim friends, and reading some of the relevant books. I don't really have a religion, but in some way, as my life come through, I think there's a God, and they have the best arrangement for us. And whenever the right time, the people shows up, it's something well arranged. And for us, I don't have a religion, but I believe in God. After so many years.
Yes, that is an evolution, isn't it?
Review our life. Many things you can't say coincidence.
I think I've gone the other way. I'm probably at the point of view similar to you in that I'm agnostic. There's something, and on one level, we all came out of the Big Bang. We're all stardust. So the idea of God within us, as the Quakers would argue, that makes a lot of sense. But it is frightening to me. It's quite shocking to me how much we rely on coincidence. But what really inspires me is people like you who take coincidence not as something to be scared of and to hide from, but something to use and exploit and develop in order to improve the lives of the people around you. Which sort of gets us to that 38,000 foot level. Again, in the sort of 15 years or so that you and I have been working together and thinking together, trying to explore how we make sure that China and the little L liberal Western economies and societies stay connected, stay engaged, because that's in everybody's interest, economically and socially and individually. How do you feel at the moment, now that we're seeing a very specific US strategy of disengagement with China? What are your thoughts about that philosophically, but also, is that affecting you and your business and you and your social enterprise work?
Not really. Not really affecting to me, but it's annoying me. And because I think that this world should not be disconnected. And actually, country like China and US, if really can hand in hand together, can make a lot of big change in the world. And also, now this kind of tension, it's not good for the world, and also, you can say we are not civilized enough, our society. So just like a competing, and as a Chinese, we can say that China learned from the past lessons in the Mao time, the Cultural Revolution, and after that, the U.S. model inspiring us a lot. In the late 70s, especially early 80s, we were listening to the cassettes. It's not a singer. It's the scientist who visits U.S., come back and talk what U.S. likes. So inspiring. We copied those cassettes, copy and listen. So it was spreading around by the time no internet, right? So we try to get any books talk about U.S. We're learning from it. So United States was a great country of democracy and also the most innovative industry country in the world. So it's from scientific and to industrialize everything. So actually, basically, all the Chinese like US and learning from it. Okay, for somehow we don't know, maybe the leaders don't like each other. From the people's perspective, And also, I don't know much until after year 2000. I started working on kind of like a charity or NGO work. I found out U.S. everywhere. U.S. funding, U.S. specialists, experts, everywhere to helping the world. I was so impressive. Okay. Of course, I don't mean only U.S. Europe also did a great job. So I think by that time I have very good impression on U.S. and for U.S. people still, but I just don't quite understanding what happened between the two governments.
And you describe, I guess, the soft power in the 2000s of a US that was committed to engagement with the world. And whether you were a Republican or a Democrat, you were still wanting to make the world a better place. And of course, now we're getting rid of all the scientists. We've got rid of USAID in our overseas development. So, but I tell you what, on this trip, I have been so overwhelmed. As you know, I love cars. So overwhelmed at the quality and breadth and availability of Chinese electric vehicles. BYD, that was heavily invested by the Buffett family, and you know, Buffett himself was on the Gates Foundation for the longest time.
Yeah.
But there we are, BYD. But some really beautiful cars coming through, and my gosh, that's more advanced than, you know, what we've got in the United States. We're going to have to square that circle in some way. Well, we're coming up to the top of the hour, Thomas, and I realize we haven't covered the work of the Hepatitis Elimination Alliance in Cambodia. And you and I both know that if we don't talk about that, the wonderful young digital and social media team that you have created to promote the Hepatitis Elimination Alliance will absolutely have our asses, will absolutely have our guts for garters. So, what is the Hepatitis Elimination Alliance in Cambodia?
Okay. Hepatitis Elimination Alliance is a local NGO, a group of young, passionate people. They are aiming to doing hepatitis elimination goal, achieve this goal by uniting the medical professionals, private sectors, government, and community together. To trying to use a unified power to tackling the issue with the local resources. Of course, doesn't mean we exclude foreign aid, because we should using the foreign aid meaningfully instead of creating dependency on them.
And I've got to say a shout out to that team of yours. They are going to be working with us on a shot in the arm to help build up our digital and social media clip and YouTube shorts and reels, Facebook reels content. So thank you. And all part of our international partnership. Well, Thomas, is there anything else that we've missed? Anything that you think that our listeners and viewers really ought to know about the work that you've done, the lessons you've learned, how they should incorporate it into their own work and worldviews?
Okay. I think in my life, I learned one thing is money is a drug. And most of the people in the world getting heavily addicted and dependent on it. It's very, very harmful. And I think when we're running social enterprise, it's a little bit like a socialism. But actually, it's like we need to have, if we are having a right value on money, we will live happier. And actually, nowadays, I'm almost 60 years old, but I don't have a plan to retire. But because I think life is a journey, I try to experience more and do more in my life. And one thing I've changed a lot is I know money should be used to do something meaningful instead of like keeping them in the bank as a number. And Of course, we need to have a good balance on both sides. And also the best thing you can pass out to your children and children's children is a better world. It's not the money in the bank, not the property. Hey, if everybody think about this, and then I think the world will be really a better place. And so not just money, we need to have a good balance, good diet, like money like sugar. Don't get diabetes. Right? Don't take too much.
Capitalist diabetes.
Yeah.
But you haven't said it, but this is one of the things that has really inspired me about you and has changed my thinking a lot. And it is that I grew up in Margaret Thatcher's Britain, and I took a visceral, I would almost say, hatred to Thatcherism as a result of the impersonal, almost deliberate, willful damage that Thatcherism did to British society. And that made me, I guess, for British listeners and viewers, this may or may not make sense, a Neil Kinnock socialist, so a social democrat in the style of a very particular British Welsh political leader. But you've taught me that the socialist state, the bureaucratic state, can get fossilized very, very quickly and stuck in its way in its bureaucracy. Now, the same is true for multinational businesses.
Yeah.
But the thing that liberates one from capitalism actually is not capital. It's not money. It is innovation. It is having impact. And as much as we're leaving things for our daughters and our sons, in my case, my niece, nephews, and godchildren, it is also about creating a world that is sort of, I don't know, to the extent we can, slightly better, or at least going in a better direction than when we found it. And that can be hard to see sometimes. But it is the innovation mentality, the creative mentality, and perhaps that's the way we need to think post-capitalism and socialism. But it's that is now, I think, really important, and that's the big life lesson that I think you have given me. Well, Thomas, I've shut you up. That's pretty impressive. I've never done that before in my life.
Okay.
Thank you so much for coming onto the podcast. There's a whole lot of stuff that we didn't cover, and I would love to come back in future episodes if you're willing.
Yeah.
Great.
Sure. It's good to sharing my thoughts and my part of my life to everyone. And thank you, Ben.
Well, that's it for this episode. Thanks to our Thomas. Thanks also to Eric Espera, our executive producer and director. He's in Washington, D.C., while we're here in Cambodia. Thanks also, of course, to the Hepatitis Elimination Alliance Cambodia digital media team. Yes, we remembered you and we're looking forward to collaborating with you. And finally, a big thanks to you. Now, I said at the start of the podcast that we couldn't do this without you, so don't forget to subscribe, give us 5 stars wherever you download your audio podcasts, and of course, visit our website, our YouTube channel. Our YouTube channel is www.youtube.com/@ShotArmPodcast. See, Thomas, isn't that impressive? I know it. Again, give us 5 stars, subscribe, and smash that notification button so that whenever we do have new episodes, you'll be the first to know. Well, with that, have a great week and a safe week, everyone.